Hi, I am Ken Howard, and welcome to the Gay Therapy LA podcast. Today, I want to talk about gay men and sex during COVID-19. So, as I continue to see clients, normally on Zoom or on FaceTime during what I call the COVID era, I notice patterns about how my guys, as I call my clients, are coping. I mean, of course, dealing with the whole COVID-19 pandemic and its many stressors, about the economy, work, housing during the quarantine, relationships, and dating, these all manifest in different ways depending on where you live, where there might be heavier or lighter social restrictions, such as whether your local gym is open. They're not in Los Angeles. And whom you live with. I notice that single guys have a tougher time overall than partnered or married guys. And what you do for work, assuming that you are working and you're not just laid off, and that you can do your work online, or you're working in some kind of a setting with social distancing or precautions, like as a restaurant server, for example. And mixed in with everything else in life, of course, is sex. I've tried to look into the sexual aspects of dealing with COVID-19, especially as I've been working fast to complete the various requirements in the process to become a certified sex therapist, which should happen for me by about January of 2021. It's kind of nice to have a project or several during a pandemic and this torturous election season. And as I considered the philosophical and, more importantly to my clients, the practical considerations of how to handle the idea of sex during COVID, I'm reminded of some guiding principles that maybe all of us would do well to remember. I'm fortunate to have what therapists call clinical supervision as part of the long continuing education process, even as a licensed therapist, that certified sex therapists must accrue. And two of these clinical supervisors, one of them is David Ley, L-E-Y. He's a PhD. He's the author of many wonderful books on sexuality and sexual health, including The Myth of Sex Addiction, and also one called Ethical Porn for Dicks, about the positive aspects of porn and exploring these in a scholarly and a clinical and a affirmative social way. And the other one is Michael Vigorito, who, along with Doug Braun-Harvey, wrote the book Treating Out of Control Sexual Behavior, which is a wonderful, clinically sound, research-based alternative to the charlatanism of sex addiction treatment. Sex addiction is not a diagnosis. It doesn't have clinically proven outcomes. It really is just rife with a lot of moralism, and it's not really something that legitimate sexologists and sex therapists embrace. And they give a very scholarly and clinical alternative to what treating sexual behavior that feels out of control is like. So I've had the benefit of consulting with Michael Vigorito directly and with David Ley, and they've been enormously helpful in many different sex therapy topics. And then in turn, I help my clients with those things as a therapist, as a sex therapist, and I also do quite a bit of relationship or career or personal coaching all over the world, really. So if you're listening to this, in another country besides the United States, or where I am in California, you can still work with me if you live abroad, and we just work online, and we note the time zone difference, and maybe some stuff about the exchange rate of currency and things like that. But I do work with guys in other country in my coaching practice that kind of runs parallel in a way to my therapy and sex therapy practice. So getting back to the Vigorito and Doug Braun-Harvey book of Treating Out of Control Sexual Behavior, they give us what they call the 6 principles of sexual health. And so with their inspiration, let's discuss each of these, and then I'm going to give it in the context of COVID-19 and more specifically gay men. So there are 6 of them. The first one is consent. So sexual health involves both a cooperation and permission to share sexual energy and activities with a willing partner, which usually means another consenting adult, but I also take it to mean 2 consenting sexually active adolescents as well, because we all know 16-year-olds have sex with each other. It's called prom night. But I'm kidding. But I validate the right of adolescents to have consensual sex with lots of sensitivity to their needs. And of course, and that's you don't want to mix those. You don't want to have an adult with an adolescent, because that's statutory rape and is illegal, and it's subject to laws and ethics and things like that. But when we say consent, we either mean consenting adults or consenting adolescents as peers. But in this COVID era, consent means that 2 or sometimes more people are engaging sexually with an assumption that the players involved know how COVID is generally transmitted, and they're doing or refraining from doing whatever they feel comfortable with in terms of risk tolerance for exposure risk, and that everyone involved is reasonably informed of how to take measures to protect themselves, particularly from COVID, but also from other sexual health considerations, sexually transmitted diseases, STIs, or certainly HIV exposure would be the big one, using PrEP or condoms or some combination thereof, or one or the other. And taking these considerations, as well as any personal, emotional, cultural, spiritual, or social considerations as well. So the first one's consent. The second one is non-exploitation. Now what they mean by this is that no sexual partner in the couple or in the group, in group sex, is misusing one's power and control to take some kind of unfair advantage of their partners. They are considering the potential risk of harm, but also mutual reward. And in COVID, this means that both parties are only doing what they feel comfortable with, given their level of risk and any underlying complicating factors, like their age or their health status in some way. Maybe a younger person might draw the line more conservatively if they live with elderly relatives, for example, who are even higher risk if they were to contract COVID. Maybe an older person might opt for masturbation or some kind of video-enhanced sexual activity instead of in-person acts. And we'll talk about some tips about what could actually be done sexually in the context of COVID a little later on. So non-exploitation is the second point they make in the book. Number 3 is protection from STIs, sexual transmitted infections, and unintended pregnancy. So sexual health principles always involve a consideration of the reality medically of sexually transmitted infections and how a person performs the self-care, like any other aspect of medical self-care habits, of screening and, if necessary, treatment of STIs. The prevention of pregnancy is also a consideration, certainly for heterosexual cisgender partners, but it's also an issue for partners who might be trans but still fertile. Like a transmasculine individual can and sometimes do get pregnant, which is something far too many healthcare professionals overlook. So when we add in COVID, while COVID is not especially considered an STI, there can be risks of transmission during sex. So especially for gay men, besides the usual considerations of sexual health involving HIV prevention, such as with PrEP and or condoms, and STI prevention and screening and detection and treatment, there is that additional layer of protection in terms of where they might draw the line of what they will and will not do sexually in consideration of COVID prevention as well. Number 4 is honesty. As a therapist, I see many examples for both gay male couples and sexually active individuals who are single, where honesty is a very important component of sexual health. frank communication without self-censorship or shame of what you do want and what you don't want in sex is very important. Honesty certainly is a huge component of both monogamous and its many variations and consensual non-monogamous relationship and its many variations. I'm also currently in a program with the Sexual Health Alliance in the United States to become certificated or certified in consensual non-monogamous CNM relationships. And a lot of the couples that I work with, as gay male couples, some are strictly monogamous and they don't even watch porn without each other. Others are basically monogamous, but they might have the occasional threesome. And others are in consensually non-monogamous relationships where they each have sexual partners outside the relationship, and sometimes our work is to talk about what the ground rules for something like that would be, what is and is not considered okay between the primary partners. Now, many things can be achieved in sex, whether it's a hookup or a long relationship, just through being honest. And in COVID, honesty about where you've been hanging out, how many people you've been socializing with, whether or not you've been in lower risk situations like outdoor restaurants that are socially distanced, or higher risk like large gatherings like pool parties or house parties or crowded gay bars or clubs or resorts. What kind of context have you been in socially, and to what degree you and the others around you have been masked or not, or are all key variables. And this kind of honesty with any potential sex partner helps to determine how much they are or are not willing to do with you sexually. Maybe they'll play with you, but they want both of you to wear masks. Or if you've been relatively quarantined, maybe they're okay with not wearing a mask in sexual activity with you. Number 5 on the list is shared values. Now, this principle doesn't mean that you have to be the same culture or religion or spirituality or even political party, but it implies that the best sex happens when the motives, standards, and meanings of sex are discussed, even if you're just kind of casually, lightly agreeing that this is a hookup. And in COVID, shared values might mean to what degree you are both committed to doing what you can to contain the pandemic as responsible citizens, but also perhaps applying principles of harm reduction, meaning that you are balancing the obvious social imperative to contain the spread of COVID along with an understandable, powerful human need to gratify oneself sexually, especially since the challenge of our society and in so many countries living with COVID implies that we are making adjustments for certainly months already and possibly years before we really return to a pre-COVID lifestyle worldwide. Then the 6th and last principle from Vigorito and Braun Harvey about principles of sexual health is mutual pleasure. We do this for fun. This implies that everybody is having a good time, similar to the non-exploitation idea. Even in BDSM play, where the pleasure can be through certain kinds of playing with the idea of pain and stimulation, it's still about creating a mutually gratifying experience between the dom and the sub, or the top and the bottom. And in COVID, making behavioral adjustments in practical terms can mean mutual pleasure at the same time that there isn't unreasonable risk. Not unlike what gay men have faced for years with the prevention of HIV/AIDS through safer sex, which can mean anything from what you do, manual, oral, anal, etc., whom you do it with, or how you do it. Top, bottom, strategic positioning, the use of condoms, the use of PrEP, or some combination of all of these, to have a good time in life-affirming ways, but without some kind of real price tag, which goes beyond, the fee that an escort might charge. There's another episode on gay men seeing escorts, rewards and risks, so you can look for that in another episode. There's also a blog article about that if you go to gaytherapyla.com/blog and look for escorts. You'd find that article if you're interested in that. Gay escorts are kind of a global phenomenon, and they meet a certain social need, even if in many places it's regulated or even illegal. Let's switch gears a little bit and talk about the World Health Organization guidelines about some additional points about sexual health. So the World Health Organization says that when viewed holistically and positively, sexual health is about well-being, not merely the absence of disease, but it's about well-being of the partners involved. Sexual health involves respect, safety, and freedom from discrimination and violence. So none of this like exploitation or trafficking stuff. It's about respect, safety, and freedom. Sexual health depends on the fulfillment of certain human rights. A human right to connect, a human right to enjoy your sexuality, a certain human right to control your own body without social or governmental interference. Sexual health is relevant throughout the individual's lifespan, not only to those in the reproductive years, but also to the young and the elderly. Sexuality is really a lifelong kind of thing, from, little boys playing with their pee-pee when they're 2 years old kind of thing, all the way up to sex among seniors, senior citizens, that you can be quite elderly and still be sexually active, which is one of the great secrets of the world. We don't think of elderly people as being sexual, but the reality is that they are. Sexual health is expressed through diverse sexualities and forms of sexual expression. Now, this is the World Health Organization, so they're having to tell even sexually conservative countries, like in the Arab world and stuff like that, that sexual health ideally is expressed through diverse sexualities and appreciating that diversity of lesbian, gay, bisexual, trans people, and the forms of sexual expression, everything from the vanilla to the kinky. And sexual health is critically influenced by gender norms, roles, expectations, and power dynamics. So on a world scale, the role of women, for example, a lot of times the sexual health rights of women are run over in certain societies. And women having equality and equal claim to sexual health and sexual expression is kind of a Western idea. So that's all controversial. I don't write me letters. That's but the point of what the WHO is saying is that sexual health is influenced by gender norms and roles and expectations, or the variations. We want to assert the rights of gender non-conforming people to also have a sexual expression. And then they also say that sexual health needs to be understood within specific social, economic, and political contexts. So the sexual landscape of many different countries would be influenced by what's going on socially and economically and even politically. And you would even have that in the United States, right? So when we apply these ideas to COVID-19, we again revisit the idea that we cannot simply ignore or try to repress aspects of sexuality just because there's a global pandemic that has killed hundreds of thousands of people. And these were unique, valuable, wholly irreplaceable human beings. They had names. They were somebody's father or mother or sister or brother. We get these numbers about COVID deaths. No, it's a number. We forget that behind every number was a real human being who had an important contribution to the world. And that's kind of sobering. The magnitude of the morbidity and mortality that COVID-19 represents, certainly demands attention, response, and adaptation of behavior by anyone with any shred of social conscience at all. But as we've seen, not everyone has that social conscience about COVID-19. You have people that will resist any kind of public health guidelines or restrictions. And that's in part why the pandemic persists with, relatively little containment, actually, especially in some parts of the United States, is because we don't have universal agreement about the social conscience to really adhere to public health guidelines. but public health guidelines are variable by region, by country, by state, even by county. And so it gets confusing. Just like it was confusing a little bit during the height of the AIDS crisis about whether or not oral sex was safe. I'm old enough to remember those days, but back in the days at the height of AIDS, there was a lot of discussion and anxiety around what is actually safe versus what isn't, and it took a while for that to be, kind of common knowledge. So, and just like in the HIV/AIDS crisis era, where celibacy or complete abstinence from sex was simply not a feasible human response to the human sex drive worldwide in all sexual and gender identities, I think so too it is with COVID-19. We can't expect complete celibacy or complete abstinence because the obliteration of sex, no matter how easy a suggestion it is, it's just not feasible. So what we're left then is to apply the principles of harm reduction. And anyone who needs an explanation of what harm reduction is might enjoy the old joke about the risks of masturbation. Don't do that, you'll go blind. Well, can I just do it till I need glasses? That was the joke about masturbation. And it came from an old wives' tale about, the connection between ill health benefits and masturbation from, sexually repressive corners of the world. Harm reduction is actually the very mature, practical, logical response to two or more competing values. We all want to avoid getting sick with COVID and having temporary or permanent damage to our health and subjective functioning, not to mention to avoid death of ourselves or our loved ones. But we are also created with a sex drive, except in the case of asexual people, but I think that's another topic worthy of discussion another time. Life, including our sex life, goes on, and that is true even in times of famine, plague, and war. And what every person, and more specifically here gay men, needs to do is to become as informed as possible on the current data, which might evolve over time as new data is determined and released and studied, on how COVID is transmitted, and then make decisions as to where their personal boundaries are in terms of sexual activity. From the most conservative approach, no partner contact and just relying on variations of masturbation for sexual expression, to the more expansive approaches, which might be possible under certain guidelines. For example, most people would be very anxious to see groups of gay men or anyone congregating without masks or social distancing. From Trump rallies in the United States to gay resort events, which I've heard about, the summer in Provincetown, Massachusetts, B-Town, or Fire Island, New York, or events such as Atlanta Pride. All of these were known where gay men were congregating with kind of a high risk of COVID transmission, and that was very controversial in the United States. But, to my knowledge, we don't know for sure that these events were COVID super spreader events, although there have been some reports that the Sturgis motorcycle rally in South Dakota was a super spreader event. Many cases came from that event from people being maskless and not socially distanced, along with some of the Republican Party events and rallies as well in recent weeks, where supposedly even President Trump was exposed to COVID, but there is some question about whether or not that was true or if it was a political stunt of some kind. So one of the stressors of COVID is that we're not really sure exactly what to believe unless we really understand the situation in depth. But there's some evidence that relatively large groups of gay men congregated, such as Atlanta Pride, without necessarily a COVID uptick, although early in the year a number of cases and even some deaths were related to Winter Party Miami in early March, which was a big gay event. So with somewhat conflicting news stories, we as gay men are left without all the information that we really need. But, we can take what information we do have, such as guidelines from the U.S. Centers for Disease Control and Prevention and their website, based in Atlanta, on what to do or not to do for reasonable COVID prevention. Like so many medical and health guidelines, the application specifically to gay men can be elusive. I, for one, get tired of the feeling that I have to translate so much mainstream heteronormative material for myself as a gay man. So much material makes the heterosexist assumption that anything about men's health is about straight men's health or cisgender men's health, and anything about women's health ignores lesbians. And that's, before the almost assured ignoring of anything that involves, trans-affirmative medical guidelines. So COVID is no different. And fortunately, there are some exceptions, such as when, the British Columbia Center for Disease Control suggested glory holes as a harm reduction measure. And, unfortunately, the heterosexist and generally sex-negative media took more of a derisive or devaluing approach to this, rather than giving them credit for giving us actual practical advice that's clever and usable. And you can look that up, the British Columbia Center for Disease Control and some of their guidelines for sexuality, along with some others I'll tell you about. So the old standby for gay affirmative journalism in the United States, The Advocate, which I believe is straight-owned, as if you couldn't tell already by some of the recent material, they had a particularly brief and cursory and generally low-quality and unhelpful set of guidelines on theadvocate.com. And while this contains some useful tips that you should probably review and consider for your own adoption, I thought that they could have gone a little deeper, pun intended, okay? They could have gone a little deeper on this topic to address some of the mental health issues. So let's talk about that. Let's talk about the mental health issues of COVID-19 for gay men. So as a gay men's therapist for over 28 years now, of course, I'm going to consider the mental health angle of all this. And let's start with the idea that gay men know a bit about containing global pandemics, and the losses and fears and stresses related to them, because many of us have been impacted or lived through the height of the AIDS crisis. And I've also written previous articles and had previous podcast episodes on the mental health aspects of working from home and COVID impacting gay men. COVID is a new, scary, powerful, and drastically unwelcome turn of events for everyone, but in gay male culture. There's this sense among us older gay men that we gave at the office already in the 80s and 90s. We kind of had our fill of contagious pandemics with HIV/AIDS, enough to last a lifetime right there. So many gay men have had to deal with a sense of deja vu or even a revisiting of trauma of friends and loved ones and relatives and partners and spouses and even ourselves, to being sick or dying from Mother Nature being a real bitch sometimes with like an HIV. COVID doesn't just, as if HIV/AIDS ever did, affect gay men. In fact, there are some discussions about whether it's affecting gay or even HIV-positive men less than the general population. If, there's some discussion that maybe HIV antiviral meds are conferring, some kind of benefit even with COVID, even though it's a drastically different virus. And we say that, if vicious religious bigots said that AIDS was God's punishment for gay men, what are they saying now about COVID affecting mostly straight people? Instead of the politics of anti-gay rhetoric, it's been politicized as a Democratic hoax by Donald Trump. Not only early on, but actually to this day, pitting, red Republicans, again, intended with their ties to Russia, with blue Democrats, so named for being blue in the face from screaming at Trump and his cronies' atrocities at handling the COVID pandemic so pathetically and so incompetently. And like AIDS, the COVID pandemic requires us to try to find the best parts of ourselves for optimism, resilience, and what social workers like me like to call adaptive coping of the situation, to the situation. And gay men know this very well too, and fighting systemic oppression for decades or centuries, as well as we learned the coping at the height of the AIDS crisis. There were many different coping responses socially and politically and in our governments to respond to the AIDS crisis competently. We endured then, we will endure now. In fact, we had safer sex then. We will have to have a new version of safer sex now to respond to a different kind of virus in COVID-19 as opposed to HIV. And as the gay icon Cher sings in a song written by Diane Warren, a great songwriter, "You haven't seen the last of me." And she says, "I've been brought down to my knees. I've been pushed right past the point of breaking, but I can take it. I'll be back on my feet. This is far from over. You haven't seen the last of me." For individualized support during these difficult times, for you as a single person or as a gay male couple, I invite you to consider therapy or coaching online sessions. They're available to anyone with an internet connection. You can email me, ken@gaytherapyla.com. That's the website, by the way, gaytherapyla.com. Or you could text or call me in the United States or anywhere you're dialing from. The area code is 310-339-5778. So 310-339-5778 is my cell. I think texting is actually a little easier and a little faster if you'd like more information on how to become a client. Also, we talked about today the British Columbia, Canada Center for Disease Control. So if you Google that, you'll find some guidelines. The Advocate is at theadvocate.com, and it contains 15 tips for safer sex during COVID. And the UK National Health Service has guidelines on healthy sex for gay men. And all of those go into a little more depth about, some of the tips. But the bottom line is that life continues, sex continues, and it's important to think about what does that mean for you? Where do you want to draw the line? Where are you comfortable? Where are you not comfortable? And it's about a reasonable risk management. So, thanks, and I'll see you next time.